As the country ushers in the budget for the financial year 2024-2025, we take a close look at the health sector. Under the program-based budgeting, health financing falls under the human capital development that has been allocated shillings 10.216 trillion, a representative of 27% of the national budget. Shillings 2.946 trillion has been allocated to key priority areas that include promotion and implementation of interventions for disease prevention, provision of essential medicines with additional 100 billion, improvement of welfare for health workers, including medical interns and doctors, construction and rehabilitation of more health infrastructure, and provision of medical equipment and digitization of the national health system to facilitate service delivery.
The health sector needs a lot more money, but I want to believe that as the economy improves, and you heard very clearly how we must mobilize more revenue, but also generate our own oil, the health sector will be boosted even further. We realize the challenges we are facing, and most important thing is to prevent disease. If we can get rid of malaria, end AIDS by 2030, put an end to TB, most of the money that will be saved from these communicable diseases can be plowed into the system.
Although the civil society organizations under their umbrella body, the Civil Society Budget Advocacy Group, commended the government for the nominal increment in the budget allocation for the financial year 2024-2025 from 52 to 72 trillion, they are concerned that areas like health have not reached the levels that can make the country achieve universal health coverage.
So even from last year to this year, though, there is a slight increase of about 400 billion, but that's a drop in the ocean, and you see it's going to very particular things: the Heart Institute, the Cancer Institute, general hospitals. Of course, general hospitals contribute to achievement of universal health coverage, but in terms of percentage allocations, we've stagnated. In nominal terms, the amounts, those have increased significantly, but the population has grown, and percentage-wise, that has not increased. So it's still a big concern. I think health remains an underfunded priority, whereas it's lumped under human capital development. I think it would be very good to disaggregate and look at it as a separate program, because even human capital cannot develop if they are not healthy. You want to train them, you want to develop their capacity, they want to gain knowledge if they are not healthy. So I think health is still a unique program that should be prioritized and well funded.
They have commended government for investing in interventions that have reduced maternal deaths.
Congratulate government, but also all the stakeholders that are involved in this. I think that's highly commendable. I think there have been initiatives to reduce this in the response with our maternal health, doing those maternal death audits, but also improving stock of some of those commodities that stop maternal mortality, but also overall sexual reproductive health programming.
Government has also been urged to promote initiatives that can sustain domestic financing for key areas in health, since external funding is continuing to narrow.
We have like the AIDS Trust Fund, which has never been operational, but that's an initiative that would have contributed to the HIV response, which many donors globally have moved, I think, because HIV is no longer a concern for these global north partners, the developed countries or the high-income countries, and they are moving. Same as malaria, they are no longer. It's no longer a problem. So those are not priorities to them, but they are priorities to us. So initiatives like the AIDS Trust Fund should be operational, because it has everything. It has a law, it has guidelines for its implementation, but it's not operational. So such initiatives are the ones that would help increase financing for health. Also, the National Health Insurance Scheme. I think in the region we are the only country without that scheme. So it's another critical initiative to ensuring that we reach universal health coverage. So it's calling upon our government to ensure that that bill is passed and we have a national insurance scheme which is a safety net, especially to those that are vulnerable, because we see about 50% of Ugandans, according to our national health accounts, accessing healthcare in the private sector, meaning they're paying out of pocket these catastrophic expenditures. So we need this scheme, the National Health Insurance Scheme, to prevent those catastrophic expenditures that hinder people from accessing healthcare.
Equitable healthcare financing is critical because a healthy population is key in contributing to the development of the country. Adia Nakute, UBC.